Welcome to our NCLEX Practice Test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. Which of the following medical terms means surgical fixation of the stomach? A. Abdominoplasty. B. Gastroplasty. C. Gastropexy. D. Abdominorexis. Correct answer, C. Gastropexy. Gastropexy is a medical term meaning to surgically fix the stomach in place. The similarly spelled gastroplasty is a surgical reconstruction of the abdomen. 2. The mitral valve is synonymous with the term left ventricle. B. Right atrium. C. Bicuspid valve. D. Tricuspid valve. Correct answer, C. Bicuspid valve. The mitral valve is also known as the bicuspid valve and can be found on the left side of the heart. The bicuspid valve is located between the left atrium and the left ventricle. 3. A mother who has been breastfeeding her infant since birth wants to transition her baby to solid foods. The child is now 6 months old. Which of the following is the most appropriate response of the nurse? A. You should breastfeed exclusively until your baby is 12 months old. B. You can start solid foods and change to formula feeding. C. You can start with rice cereal and continue with breastfeeding. D. You can start with feeding meats and vegetables. Correct answer, C. You can start with rice cereal and continue with breastfeeding. Children may start taking solid foods around the age of 5 to 6 months. The American Academy of Pediatrics recommends breastfeeding until a child is 12 months or older. However, parents may begin to feed solid foods in addition to breastfeeding. Grain cereals, such as rice or oats, are appropriate first solid foods, followed by those that are more complex to digest, including vegetables, fruits, and meats. 4. A nurse is assessing the ability of a 17-year-old patient to perform self-care upon discharge to home. The patient is newly diagnosed with type 1 diabetes mellitus on this admission. The physician has ordered Lantus insulin, regular insulin, and a sliding scale for discharge. Which would be the best method to evaluate the patient's understanding of the nurse's instructions? A. Teach back method. B. Return demonstration. C. Quiz. D. All of the above. Correct answer, teach back method. The teach back method would be the best evaluation method in this scenario. It requires the patient to understand the information and teach it back to the healthcare provider. 5. A mother brings her 6-year-old daughter into a clinic for a routine physical. The family follows a vegan diet and the child has only eaten grain or plant products since birth. Which of the following vitamin deficiencies is this child most likely at risk for? A. Vitamin C. B. Vitamin B6. C. Vitamin K. D. Vitamin B12. Correct answer, D. Vitamin B12. The most common vitamin deficiency associated with veganism is vitamin B12. A vegan diet is one in which a person consumes only plant products and avoids any type of animal products, including meat, fish, or dairy. Animal products are good sources of vitamin B12 and avoiding these foods may then lead to deficiencies of this vitamin. 6. Which of the following is an example of a fine motor skill? A. Jumping on a trampoline. B. Brushing hair. C. Standing on one foot. D. Climbing a ladder. Correct answer, B. Brushing hair. Fine motor skills are those that require coordination of the muscles of the hands and forearms. Fine motor skills start to develop in toddlerhood and take longer for children to master than large motor skills. Examples of fine motor skills include brushing hair, scribbling with a pencil, cutting with scissors, feeding self with finger foods, and using a zipper. 7. A nurse is preparing to administer an oral glucose tolerance test to a woman who is 28 weeks pregnant. What is the first step the nurse should perform to administer this test? A. Give the woman a sweetened drink that contains 75 g of glucose. B. Check the fetal heart tones for the baby. C. Check a fasting glucose on the mother. D. Tell the mother to eat an 800-calorie meal and return for a glucose check. Correct answer, C. Check A. Fasting glucose on the mother. The first step of administering an oral glucose tolerance test is to check a blood glucose level on the client. Often, the client will be required to fast before the test. A fasting glucose level before the test gives the nurse a baseline from which to compare future results. Following the glucose check, the client drinks a sweetened drink with extra glucose and the nurse checks the body's response. 8. A nurse is examining a 36-hour-old infant when she notices the child's skin has a yellowish tint. The yellow skin appears on the baby's face and chest, but the skin on the feet and legs appears pink. What is the next action of the nurse? A. Check a stat bilirubin level. B. Begin phototherapy with eye protection. C. Monitor the condition and notify the physician during rounds. D. Transfer the infant to the neonatal intensive care unit. Correct answer, C. Monitor the condition and notify the physician during rounds. Many infants develop a small amount of jaundice in the first days after birth. Jaundice appears as a yellowing of the skin and often starts in the face and moves in a cephalocaudal direction. Jaundice that occurs before 24 hours of age may be associated with illness and should be checked by a physician. 9. A nurse is caring for an aging client who has developed sarcopenia. Which of the following symptoms would this nurse most likely see in this client? A. Loss of muscle mass. B. Low oxygen saturations. C. Decreased white blood cell count. D. Diminished reflexes. Correct answer, loss of muscle mass. Sarcopenia is the progressive loss of muscle mass, resulting in diminished strength. Sarcopenia contributes to increased frailty in aging adults. For most people, the condition starts to develop after 40 years of age and is most prominent by 75 years. It is more common among inactive adults but may exist in physically active persons as well. 10. Which of Erikson's stages of psychosocial development is associated with A. Preschool-aged child? A. Trust versus mistrust. B. Industry versus inferiority. C. Initiative versus guilt. D. Identity versus role confusion. Correct answer, C. Initiative versus guilt. A child who is in preschool is classified as being in the stage of initiative versus guilt, according to Erikson's stages of psychosocial development. During this stage, a child may use his imagination more and his play becomes more competitive. The child is resourceful in his dealings and encounters with others. 11. What is the relationship between HIPAA and technological advances? A. Technology helps to foster HIPAA confidentiality. B. Computers help us to share information with others. C. Computer screens are not visible to others in the area. D. Technology places us at risk for HIPAA violations. Correct answer, D. Technology places us at risk for HIPAA violations. Technology places us at risk for HIPAA violations. For example, not logging off and having the computer screen in the view of others can lead to HIPAA violations. Although computers do help us share information with others, this has nothing to do with HIPAA when they are used properly. 12. Which technological advance is most likely to place you at risk for HIPAA violations? A. Social media. B. Word processing programs. C. Spreadsheets. D. Clouds and SOEs. Correct answer, social media. Social media, like Facebook, can place you at risk for HIPAA violations. No patient-related information or comments should ever be put on social media websites. 13. A physician is explaining a procedure to a patient that may cure her recurring staph infection. The doctor explains how the procedure is done, what to expect, the odds of the procedure curing the infection, and possible side effects and risks. The physician is preparing the patient to give informed consent. B. Protecting HIPAA by listing all of the steps of the procedure with the risks involved. C. Not required to inform the patient of any alternative therapies. D. None of the above. Correct answer: preparing the patient to give informed consent. Giving informed consent is the process of giving a physician permission to perform a procedure after all of the risks are made known to the patient. Informed consent is required in most cases, but may not be necessary in some emergency situations. 14. After a lengthy explanation of a medical procedure, the patient asks many questions. The physician answers all of the questions to the best of her ability. The patient then gives consent for treatment. The costly equipment and supplies are put into place and the patient is prepared. 2 minutes before the procedure is to start, the patient begins panicking and changes her mind. Which of the following situations would be the best way to avoid litigation? A. Document that the patient originally gave consent and proceed if the benefits of the procedure outweigh the patient's wishes. B. Have the patient sign a form that she is refusing consent. If she refuses to sign, proceed with the procedure. C. Repeat the explanation of the procedure until the patient understands that having the procedure done is the best form of treatment. Proceed with the procedure. D. Do not proceed. Document the patient's refusal. Have the patient sign a refusal to consent to treatment. If the patient refuses to sign the form, have a witness available to sign. Correct answer: D. Do not proceed. Document the patient's refusal. Have the patient sign a refusal to consent to treatment. If the patient refuses to sign the form, have a witness available to sign. A patient who refuses treatment has the right to do so at any point during the procedure as long as the procedure has not reached a point where stopping would potentially harm the patient. 15. Who of the following wrote a medical code of ethics? A. Hammurabi. B. Thomas Percival. C. Hippocrates. D. All of the above. Correct answer: D. All of the above. All of these philosophers wrote some form of medical ethics code. Hammurabi wrote the first code in 2500 BC. Hippocrates is famed for do no harm. Thomas Percival was a physician with an interest in sociological medicine and wrote a code of medical ethics in 1803. 16. In which of the following examples would informed consent be required? A. A patient is apprehensive about an upcoming surgery and chooses not to learn of the risks involved with the procedure. B. A child is rushed to the emergency room after falling from a third-story window. C. An adult in a coma in a mental health institution with no listed next of kin. D. None of the above require informed consent. Correct answer: D. None of the above require informed consent. In emergency situations where delaying treatment could mean the difference between life and death, in situations where the patient refuses to hear the risks, and in situations where patients are mentally incapacitated and no next of kin is designated, informed consent is not required. 17. A woman has died as a result of a motor vehicle accident. She is listed as an organ donor and her family is considering whether to comply with her wishes. Which of the following is true? A. The woman would have had to list herself as an organ donor and notify her family prior to her death that she has considered donating her organs. B. The Uniform Anatomical Gift Act requires the physician caring for the patient to inform the family who receives the donor organs. C. Physicians can choose to go against the deceased's wishes if the family decides that organ donation is not an acceptable choice. D. Physicians have the legal responsibility to inform patients of the risks involved in donating organs. Correct answer: C. Physicians can choose to go against the deceased's wishes if the family decides that organ donation is not an acceptable choice. Families that are left behind after the death of a loved one may not agree with organ donation. Physicians may choose to go with the wishes of the family over the wishes of the deceased if the family will suffer emotional trauma from the donation. 18. Which of the following choices would best answer the question, who owns a patient's medical record? A. The patient. B. The physician. C. The legal counsel of the office. D. No one owns a medical record. Correct answer, B. The physician. Physicians own their patients' medical records, but patients have the right to have copies of their records. 19. Which of the following choices would best answer the question, who owns a patient's X-rays? A. The patient. B. The doctor. C. The facility that performed the procedure. D. None of the above. Correct answer, C. The facility that performed the procedure. X-rays, while considered part of a patient's medical record, are owned by the facility that performs the procedure. 20. Which of the following reasons would be legal when considering a patient's medical record? A. Allowing a patient's brother to view her chart to find out her birth date and address so that he can mail her a card. B. Not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. C. Not allowing a patient to view her chart because she is behind on her payments. D. All of the above are legal. Correct answer, B. Not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. Physicians are not required to tell a patient certain health information if that information will potentially cause harm to that patient. For example, if a patient with very high levels of anxiety learns that she may be undergoing testing for a potentially fatal illness, she may react negatively by having a mental breakdown due to her anxiety. 21. Choose the best answer. To ensure adequate protection for legal issues, offices should maintain patients' charts for 10 years. B. Forever. C. Until the age of majority. D. 2 years after the patient was last seen in the office. Correct answer, B. Forever. Keeping medical charts forever will ensure that the charts are available in the event of litigation. 22. If a doctor's order calls for the administration of 500 milligrams of medication, how many grams should be given? A. 500. B. 50. C. 0.5. D. 5. Correct answer, C. 0.5. 1 gram is equal to 1,000 milligrams. Giving 500 milligrams of medication would equate to 0.5 grams of the same medication. 23. Which of the following medications would be given to treat vomiting? A. Simvastatin. B. Acetaminophen. C. Lisinopril. D. Promethazine. Correct answer, D. Promethazine. Phenergan, promethazine, is an antiemetic prescribed to treat nausea and vomiting. 24. Which of the following drugs would be used to treat GERD? A. Claritin. B. Nexium. C. Nuprin. D. Celebrex. Correct answer, B. Nexium. Nexium is a medication used to control acid secretions of the stomach and can help to decrease the symptoms of acid reflux. 25. Of the following medications, which is not used to treat depression? A. Sertraline hydrochloride. B. Paroxetine hydrochloride. C. Citalopram. D. Nifedipine. Correct answer, D. Nifedipine. Zoloft, sertraline hydrochloride, Paxil, paroxetine hydrochloride, and Celexa, citalopram, are all prescribed to treat depression. Procardia, nifedipine, is a calcium ion influx inhibitor and is used to treat pathology of the coronary circulation. 26. A doctor's order is written to give a patient a medication using a nonparenteral route. Which of the following is a nonparenteral route of medication administration? A. Rectal suppository. B. Intracardiac. C. Foredrip. D. IM injection. Correct answer, rectal suppository. Parenteral medications are given through routes other than the GI tract. Non-parenteral medications are injected or given through the skin or mucous membranes. 27. A patient is morbidly obese. Which of the following needles would be best to give an IM injection in the deltoid? A. 25 gauge 5/8 inch. B. 27 gauge 1/2 inch. C. 21 gauge needle 1/2 inches. D. 16 gauge needle 3 inch. Correct answer, C. 21 gauge needle 1.5 inches. Medications that are to be administered by the intramuscular method are intended to be delivered to muscle tissue. Patients whom are obese will have a larger area of subcutaneous tissue covering the muscles. Using a longer needle will ensure the medication is delivered in the proper area. However, a needle that is too long could damage bones, nerves, and other anatomical structures. 28. When giving an injection of insulin, which of the following is true? A. The deltoid muscle is the preferred injection site for insulin. B. The angle of the needle should be 90 degrees. C. The site should not be massaged after medication administration. D. All of the above are true. Correct answer, C. The site should not be massaged after medication administration. Insulin injections are given subcutaneously. The site should not be massaged after administration as the medication needs to distribute slowly. 29. If a medication order states that 300 mg of medication are to be given QID for 10 days, how many total milligrams of medication will be given over those 10 days? A. 3,000 mg, B. 9,000 mg, C. 12,000 mg, D. None of the above. Correct answer, C. 12,000 mg. The abbreviation QID means 4 times per day. 300 mg times 4 times per day times 10 days is equal to 12,000 mg, 30. A doctor orders 500 mg of medication. Available in stock are 1 gram tablets. How many tablets should be given to the patient? A. 1. B. 2. C. 1/2. D. 3/4. Correct answer, C. 1/2. The first step is to convert milligrams to grams. It takes 1,000 milligrams to make 1 gram, so divide 500 by 1,000. The result is 0.500 grams. 0.5 grams is 1/2 of 1 gram. Therefore 1/2 of a tablet should be given. 31. Which class of medications is foundational to treating the patient with delirium tremens, DTs? A. Phenothiazines. B. Butyrophenes. C. Benzodiazepines. D. Anticonvulsants. Correct answer, C. Benzodiazepines. Benzodiazepines are foundational to the treatment of delirium tremens, and adequate dosing must be ensured, especially if other medications such as sympatholytics and neuroleptics are also administered. Such medications may mask the early signs and symptoms that indicate a progression to delirium tremens. Delirium tremens, DTs, is the most severe form of alcohol withdrawal, and is manifested by global confusion and autonomic hyperactivity, which can progress to collapse of the cardiovascular system. Early treatment and recognition are vital. Alcohol withdrawal syndrome is classified according to 4 categories. 1. Minor withdrawal, tremulousness that occurs within 6 to 24 hours after patient's last drink. 2. Major withdrawal, hallucinations which occur 10 to 72 hours after last drink. 3. Withdrawal seizures, major motor seizures typically generalized and brief which occur within 6 to 48 hours of last drink. 4. Delirium tremens, most severe form and occurs 3 to 10 days after last drink with symptoms which include agitation, global confusion, disorientation, hallucinations, fever, hypertension, diaphoresis, and tachycardia. 32. Septic, anaphylactic and neurogenic shock are all categorized as A. Hypovolemic shock, B. Cardiogenic shock, C. Distributive shock, D. Obstructive shock. Correct answer, C. Distributive shock. The three types of distributive shock are septic, anaphylactic, and neurogenic. 33. Which of the following is true about shock? A. A patient with severe shock always has an abnormally low blood pressure. B. Confusion and deteriorating mentation are indicative of hypotensive shock. C. Patients with compensated shock may be unable to maintain a normal blood pressure. D. A normal blood pressure implies that the patient is stable. Correct answer, B. Confusion and deteriorating mentation are indicative of hypotensive shock. A patient with hypotensive shock will develop deteriorating mental status. Patients can be in severe shock without any change in blood pressure. Therefore, blood pressure is an unreliable indicator of shock status. 34. Signs and symptoms of stroke may include all of following except sudden weakness or numbness of the face, arm or leg. B. Sudden confusion. C. Sudden headache with no known cause. D. Hypotension. Correct answer, D. Hypotension. Hypotension is typically not a sign of acute stroke. Hypertension, extremity weakness or numbness, confusion and sudden headache are all symptoms of stroke. 35. Which of the following may cause coup-contre-coup injuries? A. Rotational forces. B. Deformation forces. C. Deceleration forces. D. Acceleration forces. Correct answer, C. Deceleration forces. Deceleration forces are those in which the head is moving and strikes a stationary object. Deceleration injuries can include skull fractures, contusions and hematomas, and coup-contre-coup injuries. In the coup-contre-coup injury, the brain is injured on opposite sides as the brain first hits against one side of the skull and then bounces back and hits the other side of the skull. 36. Meningitis that is fatal in half of the infected patients is caused by A. Virus. B. Bacteria. C. Fungus. D. Non-infectious agent. Correct answer, B. Bacteria. Bacterial meningitis is characterized by acute onset and is commonly caused by Streptococcus pneumoniae, Haemophilus influenza, Listeria monocytogenes, and Neisseria meningitidis. Bacterial meningitis commonly presents with the classic triad of symptoms: fever, stiff neck, and diminished level of consciousness. Bacterial meningitis is fatal in approximately 50% of all cases. 37. Which of the following may alter the level of consciousness in a patient? A. Alcohol. B. Electrolytes. C. Infection. D. All of the above may cause altered level of consciousness. E. Both A and C only. Correct answer, D. All of the above may cause altered level of consciousness. An acronym that can be used to remember possible causes of decreased level of consciousness is AEAU-TIPS. These letters stand for alcohol, epilepsy or electrolytes, insulin, either hypo or hyperglycemia, opiates, uremia, trauma, infection, poison, psychosis, and syncope. 38. The term used to define uterine bleeding in which there is no menstruation in a 24-year-old woman is oligomenorrhea. B. Amenorrhea. C. Menorrhagia. D. Metrorrhagia. Correct answer, B. Amenorrhea. Amenorrhea is a lack of a menstrual period in a woman of childbearing age. 39. Which of the following diseases or disorders is acute? A. Pneumonia. B. Paralysis. C. Alzheimer's disease. D. Diabetes. Correct answer, A. Pneumonia. Pneumonia is an acute disorder or illness. It is temporary. It comes on quickly and it can be cured. All of the other choices are chronic diseases or disorders. They are permanent, but they can be treated. 40. The major difference between a grand mal and petit mal seizure is that a person with a grand mal seizure will have underscore and the person with a petit mal seizure will not. A. Convulsive movements. B. Sleep apnea. C. Atonic movement. D. Flexidity. Correct answer: convulsive movements. Grand mal seizures are accompanied with convulsive movements. Petit mal seizures do not have convulsive movement, but usually only semi-blinking or staring. Sleep apnea is not associated with seizures. It is a separate disorder. Flexidity and atonia are poor and absent tone. 41. Your patient has shown the following signs and symptoms: feeling very thirsty, large amount of water intake, dryness of the mouth, urinary frequency. What physical disorder does this patient most likely have? A. Diabetes. B. Angina. C. Hypertension. D. Hypotension. Correct answer: diabetes. This patient is exhibiting the classic signs of diabetes and high blood glucose, or blood sugar. Some of the other signs include poor vision, weight loss, tingling of the feet and hands, and feeling tired and weak. 42. You are providing mouth care to a patient who is in a coma. You should underscore to provide good and safe mouth care. A. Keep the head of the bed up so that the patient does not aspirate. B. Brush the teeth and rinse the mouth with a cup of water. C. Use a special foam swab to brush only the tongue. D. Use a special foam swab to brush the tongue and teeth. Correct answer: D. Use a special foam swab to brush the tongue and teeth. Patients in a coma also need mouth care. You have to modify the mouth care procedures to meet the special needs of people in a coma. There are special foam mouth swabs that are used to clean all areas of the mouth, including the cheeks and the tongue. You cannot use water for mouth care when a patient is in a coma, so there is no need to keep the bed up to avoid aspiration. 43. This particular gland of the endocrine system secretes a hormone that is known to assist with the sleep/wake cycle. What gland is it? A. Pituitary. B. Pineal. C. Pancreas. D. Hypothalamus. Correct answer: B. Pineal. The pineal gland, located in the brain, secretes melatonin. This hormone is known to regulate the sleep/wake cycle in response to exposure to light. 44. Digestion, elimination, and underscore are the three functions of the digestive system. A. Constriction. B. Relaxation. C. Adsorption. D. Peristalsis. Correct answer: C. Adsorption. Adsorption is a function, in addition to digestion and elimination, which make up the three functions of the digestive system. 45. Which of the following is an example of restorative care? A. A nurse teaches a new mother how to breastfeed her infant. B. A nurse helps a client with developing a bladder retraining program. C. A nurse places an allergy wristband on a client's wrist to notify other providers of potential reactions. D. A nurse contacts the family of a client to tell them he will be out of surgery soon. Correct answer: B. A nurse helps a client with developing a bladder retraining program. Restorative care involves helping clients regain or maintain the highest level of function that is possible for them. The nurse who practices restorative care helps clients to perform their own activities in order to promote self-care, such as through activities of daily living or certain types of therapies. A nurse who helps a client with a bladder retraining program is assisting the client with regaining bladder function. 46. Your patient has been diagnosed with a left ankle sprain. On the discharge instructions, the physician has prescribed the RICE protocol. This acronym stands for rest, ice, compression, elevation. B. Radiology, ice, compression, elevation. C. Rest, ice, cast, elevation. D. Radiology, ice, cast, elevation. Correct answer: A. Rest, ice, compression, elevation. Appropriate treatment for an ankle sprain is rest, ice, 20 minutes on each hour while awake, compression, usually with an elastic bandage, and elevation of the foot above the level of the heart. 47. Which of the following interventions is most appropriate when working with the family of a client who is being treated for substance abuse? A. Advocate for the client before the family. B. Provide referrals for community resources and support groups. C. Take the side of the family before the client. D. Both B and C. Correct answer: B. Provide referrals for community resources and support groups. When working with families of clients being treated for substance abuse, the nurse must remember that families have needs and issues that must be addressed in addition to the clients. The nurse can provide support for families through encouraging open and honest communication, advocating for both the client and his family, and including the family in the discharge planning process. If necessary, the nurse can provide referrals for community resources and support groups. 48. Which of the following is a nursing intervention for a client who is having an acute panic attack? A. Encourage the client to sit down in a quiet environment. B. Allow the client to direct the situation. C. Try to focus the client on one aspect of care, such as regulating breathing patterns. D. Speak in a commanding tone of voice to get the client's attention. Correct answer: C. Try to focus the client on one aspect of care, such as regulating breathing patterns. When caring for a client who is having an acute panic attack, the nurse's goal is to help reduce the client's anxiety levels until the situation can be managed and controlled. The nurse may want to direct the client to focus on one area that can be controlled, such as regulating breathing. Clients that are hyperventilating can be directed to slow down and take deep breaths or breathe into a paper bag. 49. A nurse is assisting a client who has been diagnosed with depression. Which of the following is an example of a short-term outcome as part of the nursing process for this client? A. Client will verbalize that depression symptoms have lifted. B. Client will identify life stressors that may be contributing to depression. C. Client's insomnia will be resolved as evidenced by 8 hours of sleep each night. D. Client will identify a mental health counselor in the community with whom she can meet for ongoing therapy. Correct answer: B. Client will identify life stressors that may be contributing to depression. Short-term outcomes are those goals that the client may need to meet before advancing toward long-term outcomes. A client with depression may need to initially identify causes of the depression in order to work through some feelings of grief or sadness before she can move toward long-term goals of therapy and depression management. 50. Which of the following is an example of passive aggression? A. Clenched fists. B. Yelling. C. Jealousy. D. Intimidation. Correct answer: C. Jealousy. Passive aggression involves directing anger to others in a way that is not overt. A person who exhibits passive aggression may not be openly hostile, and this type of anger may be difficult to recognize or treat. Examples of passive aggression include jealousy, resentment, stubbornness, and pouting. 51. A client is being treated for anxiety and desires to be free from anxious feelings and despair. According to Maslow's hierarchy of needs, which level does this client need to meet? A. Physiological. B. Safety. C. Belonging. D. Self-esteem. Correct answer: B. Safety. An individual's need for safety includes feelings of security. This includes a desire to be free from anxiety or those feelings that make a client feel unsafe or unsure of himself. Treating anxiety and moving beyond anxious feelings to a feeling of safety will meet a client's needs to move on to the next level in the hierarchy. 52. Which of the following examples indicates that the nurse is giving recognition as a form of therapeutic communication? A. You need to take your medicine now, Adam. B. Jill, your father is trying to make amends with you. C. The physician wants to meet with you and your husband, Amy. D. Linda, you brushed your hair this morning. Correct answer, D. Linda, you brushed your hair this morning. Recognition is a form of therapeutic communication in which the nurse points out some positive aspect of the client's behavior. Noting that a client brushed her hair herself indicates that the nurse recognizes the client's attempts at self-care. This recognition shows the client that the nurse is paying attention and may be open to further communication. 53. During her shift at the hospital, a nurse receives a stern reprimand from a physician over something which she had no control. The nurse does not respond. When she returns home that evening, she sees her children's toys all over the floor, gets mad, and begins to yell at them. Which form of defense mechanism is this nurse using? A. Symbolization. B. Suppression. C. Displacement. D. Projection. Correct answer, C. Displacement. Displacement is the process of targeting feelings or impulses from one person toward another. Often, displacement directs negative reactions to someone who is more vulnerable or less threatening than the original person involved. In this situation, the nurse did not respond to the physician, but instead took her negative feelings out on her children, who have less authority. 54. A client is receiving treatment for delusional behavior. He believes that his neighbor is purposefully poisoning his water system in an attempt to make him sick. Which of the following responses of the nurse is most appropriate? A. Did you have the water tested to be sure? B. Why do you feel like your neighbor is trying to poison you? C. Let's just sit here and watch this television program. D. Don't be silly, your neighbor would do no such thing. Correct answer, B. Why do you feel like your neighbor is trying to poison you? When a client presents with delusional beliefs, the nurse should avoid arguing with the client and accept his initial need to hold on to the delusions. He may want to further express his beliefs. By responding in a non-threatening manner, the nurse builds trust, after which she may be able to encourage him to start giving up his delusions. 55. Which of the following people is at highest risk of suicide? A. An 80-year-old man who lost his wife last year. B. A 36-year-old woman whose former neighbor committed suicide. C. A 40-year-old married businessman. D. A 46-year-old former alcoholic who has been sober for 12 years. Correct answer, A. An 80-year-old man who lost his wife last year. Certain groups of people are at higher risk of suicide than others. The elderly, adolescents, those in high-profile professions, and those with a loved one who has previously committed suicide are all at higher risk. Women are more likely to attempt suicide, however, men are more likely to succeed when they do attempt it. 56. Mrs. J is in the adult ICU on a ventilator. The nurse caring for her recognizes that her endotracheal tube needs suctioning. Based on the nurse's understanding of this procedure, what level of pressure should the nurse apply while suctioning? 70 to 80 millimeters of mercury. B. 100 to 120 millimeters of mercury. C. 150 to 170 millimeters of mercury. D. 200 millimeters of mercury. Correct answer, B. 100 to 120 millimeters of mercury. When suctioning the endotracheal tube of an adult client, the nurse should set the suction apparatus at a level no higher than 150 millimeters of mercury, with a preferable level between 100 and 120 millimeters of mercury. Suction pressure that is too high can contribute to the client's hypoxia. Alternatively, too low of suction pressure may not clear adequate amounts of secretions. 57. The nurse caring for Mrs. J is prepared to suction her endotracheal tube. Which of the following interventions will reduce hypoxia during this procedure? A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. B. Administer 15 cubic centimeters of sterile fluid into the tube prior to suctioning. C. Suction for no longer than 30 seconds at a time. D. Wait 30 seconds after suctioning before attempting again. Correct answer: A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. Before suctioning a client's endotracheal tube, the nurse should provide extra oxygen for approximately 30 to 60 seconds. Hyperoxygenation a client before suctioning increases oxygen delivery to the tissues and reduces hypoxia that may develop during the procedure. 58. Which of the following conditions is a contraindication for performing a diagnostic peritoneal lavage? A. A client who is 9 weeks pregnant. B. A client with a femur fracture. C. A morbidly obese client. D. A client with hypertension. Correct answer: C. A morbidly obese client. Diagnostic peritoneal lavage is contraindicated in clients who are morbidly obese because excess body fat makes finding essential landmarks for this procedure difficult. Additionally, the equipment used for the procedure may not be large enough to accommodate an obese person. Finally, morbid obesity puts excess strain on the cardiovascular and respiratory systems, such that anesthetic agents used during the procedure could cause further complications. 59. A nurse is preparing to change a client's dressing for a burn wound on his foot. Which of the following interventions is appropriate for this process? F. Wash the wound with cleanser, rinse, and pat dry. B. Bind the wound tightly, secure with tape, and elevate the foot. C. Contact the physician after the dressing change is complete. D. Provide analgesics for the client after the procedure. Correct answer: Wash the wound with cleanser, rinse, and pat dry. The nurse must carefully assess and care for a burn wound during dressing changes to avoid infection, minimize pain, and promote healing to the site. Once the nurse has removed the old dressing from the burn wound in this situation, she should wash it gently with an approved cleanser, rinse the area, and pat dry. 60. A client in end-stage renal disease is receiving peritoneal dialysis at home. The nurse must educate the client about potential complications associated with this procedure. All of the following are complications associated with peritoneal dialysis except hypotriglyceridemia. B. Abdominal hernia. C. Anorexia. D. Peritonitis. Correct answer: hypotriglyceridemia. The client undergoing peritoneal dialysis is at risk of developing abdominal complications due to the placement of the catheter. Peritonitis occurs as an infection and inflammation of the peritoneal cavity, and the nurse should educate the client regarding signs and symptoms of this condition. The client may also develop an abdominal hernia, anorexia, low back pain, or abdominal bleeding. 61. A nurse is assisting Mr. L, a client who has a new colostomy after a bowel resection. The nurse is teaching this client how to care for his colostomy bag. Which of the following statements from Mr. L indicates the need for more education? A. I can clean the skin around the ostomy site with soap and water when I change the bag. B. I should irrigate the stoma regularly to avoid buildup of gas and odor. C. I need to wait half an hour after I irrigate to replace the colostomy bag. D. I should change the bag when it is 1/3 to 1/4 full. Correct answer: C. I need to wait half an hour after I irrigate to replace the colostomy bag. A client with a colostomy needs education about care of the stoma, care and changing of the bag, and irrigation of the colostomy site. The nurse should teach the client the basics of these actions as well as measures to prevent infection or other complications. The client may irrigate the ostomy and reapply the bag as soon as the skin is dry. 62. Which of the following clients is most appropriate for receiving telemetry? A. A client with syncope potentially related to cardiac dysrhythmia. B. A client with unstable angina. C. A client with sinus rhythm and PVCs. D. A client who had a myocardial infarction 6 hours ago. Correct answer, A. A client with syncope potentially related to cardiac dysrhythmia. Telemetry is used to monitor the cardiac rhythms of clients with potentially unstable conditions or those rhythms that affect activities. Telemetry is not indicated for acutely unstable clients, such as those who have recently had heart attacks, or those with chest pain related to cardiac activity. 63. Mr. B is recovering from a surgical procedure that was performed 4 days ago. The nurse's assessment finds this client coughing up rust-colored sputum, his respiratory rate is 28/minute with expiratory grunting, and his lung sounds have coarse crackles on auscultation. Which of the following conditions is the most likely cause of these symptoms? A. Tuberculosis. B. Pulmonary edema. C. Pneumonia. D. Histoplasmosis. Correct answer, C. Pneumonia. A client who is experiencing dyspnea, productive cough, and diminished or coarse breath sounds following surgery may have developed pneumonia. This condition occurs as inflammation or infection of the lung tissue with certain organisms, particularly when excess fluid develops and is trapped in the tissues. 64. Based on Mr. B's assessment, what is the first action of the nurse after assessing his condition? A. Immediately place the client in a negative pressure room. B. Set the client up to receive a bronchoscopy. C. Contact the physician for antifungal medications. D. Administer oxygen and assist the client to sit in the semi-Fowler's position. Correct answer, D. Administer oxygen and assist the client to sit in the semi-Fowler's position. The initial action of the nurse caring for a client with suspected pneumonia is to administer oxygen and assist him to sit up in the semi-Fowler's position. Supplemental oxygen will assist Mr. B with oxygen perfusion to the tissues. Sitting up better facilitates breathing and removal of secretions. 65. A nurse is dismissing a 5-year-old boy from the pediatrics unit to go home with his parents. The parents drive their car to the front door of the hospital and the nurse helps the child get into the car. What type of seat belt restraint should this child wear? A 5-point restraint in the back seat, facing backward. B. A booster seat with a lap and shoulder belt in the back seat. C. A lap belt in the back seat. D. A lap and shoulder belt in the front seat. Correct answer, B. A booster seat with a lap and shoulder belt in the back seat. A 5-year-old child who rides in a car should use a restraint system for safety. The Centers for Disease Control and Prevention do not recommend children under 13 years to ride in the front seat of a car. A 5-year-old child most likely needs a booster seat, combined with a lap and shoulder belt. In the back seat. 66. A nurse is employed at a district health department and must spend several hours each day sitting at a desk. Which principle of ergonomics will most likely help her to reduce the risk of injury or pain in this situation? A. Adjust the chair height to keep the legs bent at the hips at a 90-degree angle. B. Maintain the position of the computer monitor just below eye level. C. Stand up and take a walk or stretch every 4 hours. D. Rest wrists on the edge of the desk while typing. Correct answer, A. Adjust the chair height to keep the legs bent at the hips at a 90-degree angle. When sitting for prolonged periods, adjust the height of the chair so that the legs are bent at the hips at a 90-degree angle. This position reduces pressure on the back, legs, and feet, and the nurse may be more likely to use proper posture and reduce muscle fatigue. A person who must sit for several hours a day should get up to move around at least once every hour to support circulation and to stretch. 67. Which of the following indicates the need to file an incident report? A. The neon sign directing parking for visitors has burned out. B. A nurse must send a syringe pump to maintenance for annual service. C. A client's blood pressure dropped to 90/55 after receiving a dose of morphine. D. A client's spouse becomes angry and is asked to leave the premises. Correct answer, D. A client's spouse becomes angry and is asked to leave the premises. An incident report is a form of reporting for nurses that accounts for any activity that occurred that was unexpected. At times, incidents may happen that the nurse is not prepared for and that may involve other departments, such as client accidents, medication errors, or security problems. A situation in which a client or family who is asked to leave the premises because of behavior should be documented in case of future issues. 68. Which of the following actions of the nurse is most appropriate to reduce the risk of infection during the postoperative period? A. Flush the central line with heparin at least every 4 hours. B. Administer narcotic analgesics PRN. C. Remove the urinary catheter as soon as the client is ambulatory. D. Order a high-protein diet for the client. Correct answer: C. Remove the urinary catheter as soon as the client is ambulatory. A significant way to reduce the risk of infection is to remove the urinary catheter as soon as the client is ambulatory. Urinary catheters may harbor bacteria that can lead to infection of the bladder or urethra. 69. Which of the following is an example of an environmental hazard that may put the nurse at risk of injury? A. Loud noise from the hospital maintenance system. B. Airborne powder that contains latex. C. Chemicals containing ethylene oxide. D. All of the above. E. Both B and C only. Correct answer: D. All of the above. Nurses are exposed to various environmental hazards that may negatively impact their physical or mental health. Hazards come in several forms, some of which may be unlikely sources, including noise pollution, which can damage hearing, latex powder, which can cause allergic responses, and certain chemicals, such as ethylene oxide, which is used as a sterilizing agent and can cause cancer. 70. A nurse is caring for a client's wound that has started to bleed. After providing wound care, the nurse removes her gloves and notes that a small amount of the client's blood has come in contact with her hand. What is the next action of the nurse? A. Use an alcohol-based hand sanitizer to disinfect the hands. B. Wash hands with soap and water using appropriate technique. C. Notify the occupational health nurse about an exposure to a client's blood. D. Sample some of the client's blood to determine the presence of diseases. Correct answer: B. Wash hands with soap and water using appropriate technique. If a nurse comes in contact with blood or body fluids, she should treat the situation as if the client has an infectious illness. Whether this is true or not. If the skin was intact, the nurse can effectively wash her hands with soap and water, which is the best method of hand hygiene when hands are visibly soiled. 71. A nurse must attend a high-risk delivery in a client's room. After the infant has been delivered, the nurse immediately takes him to a warmer for assessment. What is the minimum amount of personal protective equipment for the nurse when working with this newborn? A. Sterile gown, gloves. B. Mask, gown, shoe covers. C. Gloves. D. Hat, mask, gloves, gown, shoe covers. Correct answer: C. Gloves. When working with a newborn infant who has just been delivered, the nurse must wear gloves as a minimum level of personal protective equipment. Before the first bath, the infant may have the mother's blood or body fluids on his skin that may be exposed to the nurse. 72. Which of the following diseases would require the nurse to wear an N95 respirator as part of personal protective equipment? A. Human immunodeficiency virus. B. Clostridium difficile enterocolitis. C. Vancomycin-resistant enterococcus. D. Measles. Correct answer: D. Measles. Infections that require airborne precautions necessitate use of an N95 respirator, a type of mask that filters particles that are 5 micrograms or smaller. Illnesses that require airborne precautions include measles, varicella, severe acute respiratory syndrome, SARS, and tuberculosis. 73. A 62-year-old male client presents to the emergency department via EMS after the wife reported that the client experienced a sudden onset of shortness of breath, chest pain, and restlessness. Upon arrival, the client is restless, reporting, "I can't breathe." Exhibit 3, ABG, 2040 client's results, PaO2 71 mm of mercury, PaCO2 58 mm of mercury, pH 7.31, HCO3, 26 milliequivalent/L, reference range, PaO2 80 to 100 mm of mercury, PaCO2 35 to 45 mm of mercury, pH 7.35 to 7.45, HCO3, 21 to 28 milliequivalent/L. The client's arterial blood gas results are back. Which of the following is the correct interpretation of the results by the nurse? A. Metabolic alkalosis without compensation. B. Respiratory acidosis without compensation. C. Respiratory alkalosis with compensation. D. Metabolic acidosis with compensation. Correct answer, B. Respiratory acidosis without compensation. The client's arterial blood gas, ABG, reflects respiratory acidosis. The nurse first determines the client's low pH, less than 7.35, reflecting acidosis. The nurse then recognizes the client's PaCO2 is elevated, greater than 45 mm of mercury. The elevated PaCO2 reflects the client's inability to expel CO2 from the lungs. The client's bicarbonate, HCO3, is within the expected range, 21 to 28 milliequivalent/L, indicating no current compensation from the kidneys by producing excess bicarbonate. Answer A is incorrect. The client's low pH indicates acidosis, not alkalosis. In addition, the client's bicarbonate, HCO3, is within the expected range, which is not reflective of an acid-base imbalance of a metabolic etiology. Answer C is incorrect. The client's pH is low, less than 7.35, therefore, the client is acidotic, not alkalotic. A pH greater than 7.45 reflects alkalosis. Answer D is incorrect. The client's bicarbonate is within the expected range, 21 to 28 milliequivalent/L, therefore, the acidosis is not metabolic. In addition, the elevated PaCO2 supports the finding that the client is experiencing respiratory acidosis. 74. The monitor begins alarming, and the nurse looks up and observes the client's heart rate dropping to 30 bpm and then to 0. Which action should the nurse perform next? A. Pause the ventilator and begin CPR. B. Prepare 1 mg of epinephrine. C. Call the healthcare provider. D. Check the client for a femoral pulse. Correct answer, D. Check the client for a femoral pulse. It is important to never rely on the equipment alone, and if the equipment is alarming, it is essential to always check the client. The cardiac monitoring alarming that the client no longer has a heart rate should prompt the nurse to immediately check the client for a central pulse, such as a femoral or carotid pulse. If no pulse is felt, the nurse should call for help while beginning CPR. 75. The nurse determines the client has a pulse and transfers the client to CT, where it is confirmed the client has a saddle pulmonary embolism. The healthcare provider prescribes a fibrinolytic alteplase after the client becomes hypotensive. Which intervention should the nurse perform while the client is receiving this medication? A. Monitor the amount and color of urine hourly. B. Utilize a sheet to slide the client for transfers. C. Obtain multiple sites of venous access. D. Document bruising as an expected finding. Correct answer, F. Monitor the amount and color of urine hourly. Fibrinolytic medication such as alteplase breaks down blood clots that have already formed and is utilized in hemodynamically unstable clients with pulmonary embolisms. The most common complication in regards to this medication is hemorrhage. Therefore, the nurse should assess bleeding hourly while the client receives the medication. The nurse should assess the client's urine hourly for output and color for hematuria. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.